There are new calls from the Surgeon General to place warning labels on social media platforms. In an op-ed with the New York Times, Surgeon General Dr. Vivek Murthy says parents should know that using social media can damage their kids' mental health. Let's go ahead and bring in Chief Legal Analyst Khalif Rhodes into the conversation.
All right, so Khalif, the Surgeon General can only recommend warning labels, right?
Yes,
okay,
correct.
So explain how that kind of plays into all this.
Well, he's making a recommendation that they don't have access to doing these access to social media at a full-time range like they are now, specifically warning them for the potential dangers that could come, similar to cigarettes.
So does that mean that Congress would then have to pass a
they'd have to, yes.
Okay.
He makes the recommendation, Congress pass it, then it gets issued that the Surgeon General is warning that this should happen. And again, this is something that, if you think back to cigarettes, there was no big white label on those boxes before they recognized that Surgeon General's warning prevented death. You're just not having that warning on there to let folks know that they want to type it on the side or print it. It's doing that because the Surgeon General at the time and the country at the time believed that if we notify people of potential dangers, that at some point it could save lives. Well, that's the same thing that they're attempting to do here. He's saying that this is going to cause lives at some point. There's not enough research to say that it can now, but if we're following the same trajectory, if we're allowing kids to have access to this at 10 to 12 to 13 hours a day without any warning for the potential harms that could come, we're doing them a disservice. He said this is the new alcohol, this is the new drug, this is the new tobacco, and I second that. As a parent of four, you can see the arch of how technology and how social media usage has increased over the years, and as technology increases, the usage will go up, and there's not enough research to show what the damages will be.
Well, that's the thing I was talking about, wanted to ask you about, is the research, because the warning label is a warning label but doesn't have any teeth, because when you have it on a cigarette box, if it looks something like that, I mean, people could see that, but what does it really do?
I mean, I think that's a step, and that's what he also said. He said that in his op-ed piece, that that's not the entire picture, but that's a piece of the picture that will help save lives. You start with a warning label, and then maybe you have some other things that help do that. But what you got to remember is that this is an overall picture that's not just from him. You have states that are suing them. North Carolina, one of them, that's suing the social media companies for their lack of effort to warn about the potential dangers. You have social media companies being sued by schools. There's a number of people and agencies and corporations that are suing these social media companies to ensure that our kids are protected in this situation. But I think this is the logical next step, that if you're getting a medical perspective, you're saying that from my medical opinion, this can cause danger. It at least will raise some hairs on some other people, raise a couple eyebrows and say, well, maybe I should take a look at this. Even if the kids aren't doing it, maybe the parents will then take a second chance. I mean, and the cigarette comparison is probably the best one. I don't think it immediately said if I wanted to go in there and smoke cigarettes, if I was a lifelong cigarette smoker, I wasn't stopping. But a new person that was potentially thinking about it may have been stopped when they saw that warning. And I think that's what will happen. It's the first time users, if we're making a comparison.
Have we seen legislation like this before, and what hurdles could
I mean,
face?
Tobacco's the cleanest one. I mean, when you're going to look at the closest connection is going to be tobacco. Have we seen anything for social media? For any? No, we're on uncharted territory, and a welcomed uncharted territory.
All right, Khalif Rhodes, appreciate your insight.